Hey everybody, it's Madison with Genetics for Healthcare. And I am in the airport in New Orleans, but I just returned from the War College, Executive War College, which is an annual meeting on diagnostics, clinical laboratory, pathology management. It's the world's largest event focused on exclusively the manage of medical laboratories and the ecosystem that supports them. And I've got some big takeaways from this meeting that I wanted to share with you guys because it's current information. It's incredible to have professionals, laboratory professionals, lab managers, pathologists, medical directors, and the industry that comes together to talk about the trends and the strategies needed to adapt to build a strong laboratory business because this is the business of healthcare. Now, I got three disclaimers before we get into that content that I think are very important. Number one, I'm not a member associated with the War College in any way. This is an annual meeting of those people that I mentioned, and it's focused on how laboratories are going to work as a business to support healthcare in the future, and genetics is a big part of that. So I'm going to be delivering insights that are particular to genetics in healthcare. Secondly, there is far more rich and valuable content that was presented here that I will not mention nor will I cover. But I do encourage you to go to their website, Executive War College. You can find that URL easily through a Google search and follow them on their social media because there is a lot more content, valuable, I'm sure, and the speaker's topics that might be relevant to you that I don't cover here. It's great that I do this in the airport because you hear all the overhead noise possibly, but we are going to persist. And the third disclaimer, this is not a meeting that's solely focused on genetics or genomics. Although genetic testing and precision medicine is the laboratory is irreplaceable. It's essential to the scale and patient access to these insights that lead to better health outcomes. So in any case, both days of this meeting were focused on the laboratory, and I'm going to deliver the insights that I feel that are important for this topic of precision medicine and genetics in your healthcare. First, I want to start with what I think was the big idea. The big idea followed by three takeaways that were most impactful, in my view, affecting genetics in healthcare for the business of the laboratory services that support our healthcare system. So the big idea was presented off the top by the executive director of the War College, Robert Michael. He said that we're at an inflection point with healthcare in America. And what he meant by that is he showed some statistics, and I'm going to show some snapshots that I took from the presentation of the US population aging at a rate that will present some severe challenges for the government funding of healthcare, which means Medicare and Medicaid. By the way, Medicare and Medicaid is responsible for about 50%, just over 50% of healthcare spending in the United States. So we got to think about this. Thanks to the innovations in healthcare, people are living much longer. And according to populationpyramid.net, by the year 2050, in 25 years, 32% of the US population will be older than 60. That equates to about 122 million people. And Robert says that this presents really an untenable challenge to pay for these medical benefit programs, which account for, again, 50% of healthcare spend, but that doesn't even account for the Social Security programs and other social programs that are meant to support our aging population. Combine that with the fact that he reported half of Americans in a survey that was reported on CSNBC, I found, but he quoted this study that had this survey that half of Americans in the United States have less than $500 in a savings account, which means they're not adequately prepared for any emergency and certainly not a healthcare emergency. Combine that with other statistics that show that people are delaying their health care or healthcare decisions because of cost. And that might mean just going to the doctor for routine appointments because of the shared financial responsibilities, or knowing they have a condition that needs care or treatment, and they're making the decisions to delay that because of the costs. Even though there's more people in the United States that have access to healthcare because more people have health insurance, they're still choosing to go at risk as a result of escalating cost and the uncertainty around how the ripples in today's economy are going to affect government healthcare funding in the future. And this basically presents a number of challenges and opportunities for laboratories with respect to precision medicine that need to be addressed today. And I'm just going to tackle three of them. Number one, AI, AI, AI. It doesn't matter where you go. Somebody's going to bring up AI. I'm walking down the corridor of the airport, and on one of the billboards is an AI solution. Get used to it. It's here to stay, and it is improving its capabilities faster than we can possibly imagine. So the use of AI and machine learning in healthcare is going to rapidly accelerate. And if you are a laboratorian or in the healthcare system and you're not already thinking about how you're going to use AI, maybe you should tune in to episode 10 of Genetics for Healthcare, where I have Andy Moy, general manager of Tempest AI, talking about the use cases and the dynamic implications of how we can improve our health combined with genetics. And there's a lot of good content here that I'm going to share here in a second. But really quickly, with AI in healthcare, according to a March 2023 Medscape article, physicians were struggling to keep up with the flood of medical knowledge. Also, a snapshot I took from the presentation, a survey done in 2010 during that was presented in this Medscape article. It demonstrated that the medical knowledge was doubling every 3.5 years. Taken again in 2020, it was reported that medical knowledge is doubling every 73 days. Genetics is playing a big role in this acceleration of new information that's coming at a rate that clinicians just cannot keep up with. So what this does, it really presents an opportunity to offload some of these labor-intensive tasks that are routine, that may require no certifications or specialized knowledge or skill, and processes away from our human resources and outsource that to an AI model. And what's an example of that and what's a benefit? It's going to make our healthcare system more efficient because AI doesn't take days off. It doesn't call in sick. So if we think about the rapid acceleration and the doubling of medical knowledge, the implementation of new guidelines, drug indications change, and there's new ones all the time for new drugs and existing drugs. Payer policies are changing rapidly. And this doesn't have to be a manual process as it is today. When new indications come, it can take a while for medical guidelines and medical societies to even catch up and implement that into change because they don't meet that often, quite frankly. Well, this can be offloaded to an AI model to do these things. That is simply a matter of paperwork and process, and you can get buy-in and consensus from medical review boards virtually. You don't have to wait until a body meets again. So AI is going to be impactful in that. When we think about lab operations, the improved lab workflows are going to lead to shorter turnaround times, which includes improved productivity with identifying patients who need certain treatments and accelerating care delivery for those patients. And that means better outcomes. So AI is poised to make an extreme impact just on being able to keep up with the knowledge, especially in genetics and genomics. Also with labs, AI can help us reduce errors and improve accuracy in testing and test selection, not by itself. And the key takeaway was, even though it can help us be more effective and more efficient, it goes hand in hand with the experts, the pathologists, the laboratory scientists, the lab directors. when AI tools are combined to assist, that makes us much better in our effectiveness to reduce errors and improved accuracy. And here's some examples. Diagnosing cancer, for instance, or other genetic diseases. Sometimes the samples have to be procured and then shipped off, and then somebody has to address those samples and prepare them to be adequately assessed and analyzed. A lot of this manual information in terms of the uploading of information, the algorithms or processes in a particular lab can be automated by AI solutions. And how can this help us? When we're talking about the reduction of errors and improved accuracy, there were numbers presented on just diagnosis of disease, and consistently the rate of pathology accurately diagnosing disease is anywhere between 93 to 96%, which means 4 out of 100 are missed or inaccurate. And when it comes to saving lives and adequately diagnosing a patient to get them the care that they need, that's just not good enough. We can say that in some cases, even the best experts that see a specific disease every single day, all day, we can say, hey, they are 99% accurate. That means 1 out of 100 are missed. If you're that one or your family member is that one, that's not acceptable. But with the combination of AI plus the expertise that exists in our labs, we can turn that 99% to 99.9%. Now, how big of a difference is that? 99% is missing 1 out of 100, 99.9% accuracy is missing 1 out of 1,000. Which do you want? And you think about if that technology is available and your hospital system is not using it, I think you're going to ask why if you're that 1 out of 1,000. Not good enough. So it's really going to improve our efficiency and accuracy. And it's time really to embrace these types of changes. And Dr. Michael LaPosada at the University of Texas Medical Branch, Galveston, gave a beautiful presentation on the Diagnostic Center that they have stood up. And just as an aside, he reports that being a very experienced and very skilled, laboratory professional pathologist, he could sign out 10 cases an hour, depending on what the case is, depending on what the workload is, depending on how it's staffed for the day. But with their implementation of an AI solution that helped them stand up the diagnostic center, they're able to sign out now 1,000 cases a day that are complete with follow-up, preliminary data coming in, and action items or suggestions from the diagnosis to the multidisciplinary team, including a patient-friendly report. And all that can be done in a matter of seconds once the information from the diagnosis is in their laboratory system. That is dynamic. I've asked him to come on the podcast to talk about it. He agreed. So stay tuned for that. The second big takeaway for me at this meeting was how value is going to be determined by payers going forward. The basis of value in what health plans will be willing to pay for in the near future is going to change rapidly. I think a lot of people have heard of value-based care programs, which is the tracking of medical groups' adherence to treatment guidelines, for instance, and how physicians are ordering the right tests at the right time for the right patients. They're going to evaluate that variability in how doctors are treating a population of patients with the same medical conditions. For instance, are the people who need A1C tests getting A1C tests? Are the people who need creatinine tests for kidney function? Is that being recorded every time? Who's getting genetic and genomic testing when it's indicated by guidelines? For instance, for non-small cell lung cancer, we know that there's a big gap in even EGFR testing, which has been a part of medical guidelines and has therapy applications for more than 20 years. There are studies that show that less than 70% are getting EGFR therapy. So value-based care is going to come in and really make a big impact on payment of healthcare and how physicians' performance is being evaluated by payers. Payers are also going to be looking for opportunities to deploy diagnostics in a way that inform decisions and save downstream costs. Now, this is the point of diagnostics anyway, and it's not to say that your physician or physicians in laboratories all over the world are not using this. However, they're going to use this as a diagnostic measure for quality care. When a test is available, that could inform treatment decisions to save exposure to drugs that might be harmful or save the cost of care downstream that may have prevented later stage disease where cost goes up. They're going to start to evaluate that and make their decisions on how they compensate healthcare systems and physicians based on their quality care metrics. A third takeaway that I thought was really important here was the very existence of pathology as we know it is at risk. Not my words, the words of some of the presenters. There are cash-strapped health systems that are being taken over by big box laboratories. And you can look in the news and in the headlines, and you will see that the Quest and the LabCorps are taking over their labs because the lab is becoming a financially strapped cost center for healthcare systems that are already running on razor thin margins. Secondly, the demand for pathologies today outstrips the supply by the widest margin in nearly 50 years. Hence the great opportunity to embrace digital pathology and a number of other automated systems, technology. But I digress there. But the one thing that Dr. Ulysses Bayless, who is the director of pathology informatics at the University of Michigan, pointed out is they've got to start training pathologists for the future because today pathology is still being practiced as it was nearly 70 years ago, looking at disease or a biological sample on a microscope and making a decision and going from there. Well, a human can only look at so many glass slides in an hour. So the coming of AI technology, pathology is now involves it now involves mathematics, computer science, computational biology. So the training will need to evolve. The danger that Dr. Bayless pointed out is that pathology and laboratory science is in danger of being taken over by professionals that are not medically trained pathologists, mathematicians, programmers. And he suggests that pathologists need to embrace these tools and take the lead in training the next generation of physicians. Another key point to ensure the longevity and stability of the laboratory profession is increasing the laboratory's value to the healthcare system while not increasing operational costs. If you can, go to geneticsforhealthcare.com and look at episode 6 that I had with Dr. Alan Wu. He demonstrated this vital need for promoting the value of laboratory as a profession. Pathologists, forensic pathologists, scientists, all the functions that happen in a laboratory, they generally happen in silence. These are the people who make the diagnosis of disease and inform the healthcare provider that many times you are seeing face to face, but you don't see those people that have sometimes the most important jobs of caring for your biospecimen and making decisions as to what is the condition that you are struggling with or a patient is struggling with in order to get you the effective treatment. The suggestion there is pathology and the laboratory ecosystem needs to be more visible. It needs to be more valued because it has a critical role in our entire healthcare system. But because it doesn't get the shine, maybe through TV shows or movies or just the face-to-face contact a patient has when they're going through the healthcare system, no one knows about it. So there's two things that I believe that laboratorians can take away from this meeting, specifically in the area of genetics and genomics that can increase the value of what they do. First of all, promote the value of the lab to attract the best talent. Dr. Wu had a peer-reviewed study that showed through TikTok, he's attracting an audience that are interested in laboratory science. And this is not something that is typical of pathology, but if you go to TikTok, look for hashtag lab tales and view his channel, and also go back and check out the episode where we talk through this important need for the lab's value to be realized in the public sphere and be more visible. But secondly, there was a couple of sessions around the need for drug makers to get information from biospecimens. And labs all over the world have biospecimens with metadata that includes family history, what happened before, the diagnostic history that worked up to a diagnostic. But he says that the biospecimen and the metadata that exists, when you combine that with genetic information, is invaluable. And the pathology becomes a revenue generating resource that significantly increases its value to the healthcare system. And that value is existing in the lab today and not being properly monetized or paid attention to. And the suggestion and the direction of the sessions at the meeting was to turn those biospecimens and the data that exists into data products, because they're extremely valued by the drug makers, and it can speed the development of new innovations and clinical trials that are desperately needed to solve genetic diseases that have no cure. So that's my wrap up. It's quick and dirty in the airport. I actually tried to do it while I was at the War College. That didn't quite work out because of the Wi-Fi and all those good things, not including my battery on my laptop. But stay tuned. Please go to genetics4healthcare.com. Subscribe to our mailing list so you can get downloads of new podcast episodes, and also follow us on YouTube. YouTube is a great platform where you see the visual of the full episodes, but you can also follow us on any of our social media platforms. That includes LinkedIn, Facebook, TikTok, Instagram. We're all there. And also you can find it wherever you get your podcasts, Spotify and Apple Podcasts. Thank you for tuning in, and you need to follow us because we have information that's going to help patients advocate for themselves, give them the language and the confidence to advocate for themselves, and get access to new innovations that exist today that we're falling short, and there's a big gap. So thank you for tuning in, and we'll see you soon.